Me.
Hey, good afternoon, everybody, and welcome to another episode of the McShin Foundation's award-winning recovery podcast, Get in the Herd. I am your host today, Nathan Mitchell, and I am a person in recovery from a substance use disorder, and I use, as you can see on your screen, he, him, his pronouns. Today, I am so grateful to have back in, I would say the studio, but you can see we're all in separate locations. So we've got today in the studio two of my favorite people, Virginia people, local Virginians who come here from a couple different organizations they represent, but we come together collectively to become the Virginia Recovery Advocacy Project. So welcome to the show. Welcome back to the show, Tom Jackson and Shauntelle Hammonds. Good to see you. Would you like to introduce yourself, Shauntelle, and say who you are, what you do on the side, and why you're here today?
Hi, everyone. My name is Shauntelle. I use she, her pronouns. I am the executive director of Peter's Place RVA, which is a recovery organization here in Richmond, Virginia. And I am also taking on another role as the executive director of the Reach Out Project, which is a new nonprofit that me and some folks are starting here in Richmond, Virginia. So stay tuned. We'll be sharing more about that soon.
Whoa! Yeah. The Reach Out Project?
Mm-hmm.
And so we have to stay tuned for that.
Yeah. I mean, I could share more about it, but I kind of felt like, I don't know if this is the place to take over and talk about that, but
well, let's let Tom introduce himself, and then I want to hear more about that because I don't know anything about it. So, Tom, welcome back to the show, my friend. I see that you are in a secure location. How are you today?
Yeah, I am fine. I'm on a break from groups at my day job, which is as a peer recovery specialist at Western State Hospital in the Shenandoah Valley, where I work with people with serious mental illness and co-occurring disorders. I'm a person in long-term recovery, long-term recovery, I guess, at this point. I use he, him pronouns, and I'm glad to be back. I miss the two of you. It was just so delightful getting hugs from people and getting to know people better and stuff like that.
I think also on that, Tom, one of the nice things about COVID is that more and more people are asking about hugging before they're hugging, because I don't want to be hugged by everybody. Both y'all, please hug me. But, some people I'm like, but I am a hugger more and more. So welcome, Tom. Good to see you.
It's like, could I see your test results, please, before I hug you?
I wasn't that. Never mind. So, we have all. I think we were having so much fun earlier, right before the show, that we actually started a few minutes late today. So I kind of like that. Shauntelle and I will always kick it up, and then Justin was in. Tom, it's really good to see you. The last time that we were all together was in Vegas, right?
Mm-hmm.
Yeah, I'm trying to think if we've seen each other since then. So the last time I saw you, Shauntelle, you were sharing a stage. Actually, let me rephrase. Macklemore was sharing a stage with you. So do you want to talk about that? Why you were doing that? What you were doing? And all the freaking and tell me, is he really as sexy backstage as I think he is?
Is
that a lot?
No, it's not a lot. So what I was doing, I was sharing about Peter's Place, the organization that we started here in Richmond, and what we do, and just sharing a little bit of background on why recovery housing, specifically for the LGBTQIA plus community, is necessary and needed. It was a great it was a great time. I enjoyed it, and he's a handsome guy. Let's in person, on stage, whatever,
Mm.
whatever. We all have our own beauty in different ways. We're all beautiful.
It was a very diplomatic answer, Shauntelle. I appreciate that.
It's interesting. I had to do a video diversity, equity, and inclusion training today, which done by the Commonwealth of Virginia was about as exciting as you can imagine it was. And in the chat box, I put a line from your talk of, without equity, there's no equality, and without equality, there's no equity. And we'll see if that ripples its way up the food chain.
Well, I like that. I appreciate that. And actually, for those who may not understand, and maybe I'm not even clear, Shauntelle, do you mind maybe sharing? That is a beautiful line. It was powerful. Do you mind sharing what it is that means?
Yeah. So the piece about there's no true equality without equity, right? Because when we think about equity, and we look at it into the lens of providing support for folks, but just not providing support for folks, figuring out what certain groups need to be able to benefit from that support compared to other folks, right? If we think about, this is just an example, if we have a recovery organization and they have their meetings in the basement and they're like, everyone's welcome, we're all welcome here, and these meetings are open for everyone. But if someone comes in and they're in a wheelchair or they're on a walker and there's no elevator, yes, we're equally open to everyone. We say that we're equally open to support everyone, but we're not providing the resources so everyone can benefit from that support. So that's what equality is. It's giving what needs to be given to certain folks so they can benefit from the program as much as those who don't need those special accommodations.
That's beautiful. You and I and Tom, I think we lost Tom. Hopefully, Tom, you'll come back. Major Tom, what is it? Major Tom, the ground control. Oh, wait. Oh, Justin, you're not Tom.
No, I'm not Tom. Now he's back. Okay.
Look who's back. Oh, wait, that's Eminem.
Welcome back.
Tom! It's so good to see you.
I know, my phone had a meltdown.
It's the story of my life. So we all last saw each other in Vegas for this incredible conference and concert to talk about mobilizing for the recovery advocacy movement. And I know, I've been talking about this conference nonstop for a year, and probably all of y'all, anybody listening is probably a little sick of this. But I thought I got so much out of it. And I think all the build up getting to there, and all of the back and the forth and all the ideas and the exchanges and the challenges to my beliefs, going into that has just strengthened. Like I've gotten strength from being challenged, and I'm so grateful for that. And I came back energized, ready to mobilize, and not to go put down, like everything that was heard. There were some things I heard was like, maybe not, but like, okay, you know what? Together we are a real powerful constituency, right? We are real powerful. So what are you all doing getting back from this? Like, how do you all feel? And Justin, you can chime in too, because you've heard my BS.
I would love to chime in, but unfortunately I wasn't there. I'm very jealous of you all for being there, and hopefully we'll see what happens next year. But yeah, I'm really interested in hearing how it was from other perspectives. I've heard all about Nathan and how he had a blast there, but I'm interested in hearing from y'all.
What's the one big takeaway, Tom, from all that, all those advocates?
Well, it was a sense of community, and that the community's bigger and moves higher up the political sphere than I thought. That, we're everywhere now, and we're everywhere out loud now. That's probably the biggest difference. We've always been there, but I remember scene from The West Wing years ago where the chief of staff went to this, quiet room in the basement for an AA meeting in the White House, and now there's 2 members of the cabinet. That makes a difference. And that, we're talking about how do we find out where a gubernatorial candidate is at on our issues. And, we're 2 degrees of separation from getting to him. And I never would have thought that was possible. I would have thought we'd be, calling and, sending letters and stuff like that. And, with luck, it's going to be 2 phone calls and somebody who has a lot of influence on him, maybe able to talk to him.
Him being
Terry McAuliffe.
Oh, okay. The Democratic,
the
Democrat, the candidate.
Yeah.
Mm-hmm.
Yeah. So that sense of increasing community and political power, I think was my biggest takeaway, and the sense of personal community. I made a bunch of new friends. Yeah.
Shauntelle, one big takeaway or a bunch of little takeaways. What's your biggest takeaway from the experience?
My biggest takeaway is that we still have a lot of work to do. There's a lot of work to be done in a lot of areas. Talking with folks, just hearing different presentations, seeing different slides, and just the conversations with folks about certain things around like marginalized communities or providing recovery supports, or how some places like still are like fighting to have recovery housing include MAT, right? That some places don't have recovery houses that would allow folks who are taking who are on MAT into the recovery houses. And just hearing all these different problems that people are fighting to have an inclusive recovery community, but also to make sure that people get the support that they need, and without this like hierarchy of like what you have to do in order to get recovery support. It's that like we have a long way to go nationally.
Yeah, yes. If anything, Shauntelle, I'm with you there, because I kind of came back with more of a sense of urgency and, oh my God, there's way more to do than I ever thought. And what I like about, the Virginia RAP team, like what I like about the individual state teams is that, we are tasked as a state team to work on state issues. Now, my job, and my personal life, I like, working federal level too. And it's, one of the founders of our organization is a lobbyist in DC, and she works with Representative Patrick Kennedy and other people to lobby, for systemic change. But there was something Patrick Kennedy said, and Daniel put it out in your Shauntelle, in your breakout group. Daniel brought it up, and when I heard Representative Kennedy talking at the dinner, and what do I you know what? No, I'm not sugarcoating shit. When he was putting together the conversation, he was putting together discussions around how much we funded HIV in the late 80s and 90s, and funding that and making that an issue, and then working on that problem versus the number of dollars that we're spending on addiction recovery services. And he was sort of making this weird analogy that didn't make any sense to me at all. And just I don't want to presume to understand what he meant. At the same time, I can't imagine in a million years that he meant that HIV services did not deserve that money, because they did, and more. But it did kind of sound to me like he was making this weird false comparison that, just looking at it, was like, why would you make that comparison? And then Daniel brought it up, because when I heard that, I really felt, as a child who grew up in the late 80s and early 90s and saw what I thought being gay meant, because that's what you see on TV. In the late 80s and 90s, you see people dying of AIDS, or you see, some sort of, Joker character in the background somewhere who, had no real life, who was just a foil to everybody else's, plots. So, when I saw that and heard him, that just kind of brought that up again. It was kind of an ugly thing to do. What are your thoughts, Shauntelle? And Tom, you were there too. What do y'all think of that? Because I know this is a kind of a niche thing, but
Well, no, I have a lot of thoughts around that,
All
but
right, thank you.
let's keep it cordial. First of all, for me, it didn't feel good. It felt kind of disgusting, right? But I also want to acknowledge the point that when we're trying to compare the money that's put into substance use disorder and the money that was put into the HIV epidemic, and saying that substance use deserves the same amount of funding, which honestly, if you look at it statistically over the amount of time that uh, substance use, or let's say the opioid epidemic, because that's where the money's going. Let's be honest. Like the money's going to for the opioid epidemic because white
Right.
kids in suburban neighborhoods started to die, and that's when they started putting money into recovery. It's getting more money than the HIV and AIDS epidemic did. Right. If you look at it for an extended period of time, this epidemic started in like the 80s when they actually started paying attention to it. Right. And a little bit of money and resources that they put into it for a long time does not measure up to the amount of money and funding that has been dumped into the opioid epidemic within the last 5 or 6 years. If you look at it over an extended period of time, if you look at it over the extended period of time, yes, they got more money because it's been decades of money. But if you look at it in how much did they get at a certain amount of time, it was not much or much support or resources, right? But also the fact being that when we talk about inclusive recovery and we talk about recovery support and we also talk about harm reduction, HIV and AIDS prevention, testing, support, and resources and education is harm reduction. So that is part of funding for the recovery community. Because when we talk about harm reduction and we talk about on the aspect of using clean needles and things like that, is to also help people from getting abscess and things like that, but also not transmitting diseases to each other, right? So with that testing, and all those things are a part of substance use disorder treatment. So we should not separate it. By separating it, it's also bringing a rift in our support, but also excluding people in our community who might be struggling with HIV and AIDS, because we come in with a lot of different identities,
Yeah,
and it's just it to me is disgusting. I'm just going to say it. It's disgusting to compare one epidemic that's affecting certain people to another epidemic that's affecting a different group of people, and saying that one deserved more money than the other. If we want to compare things, let's compare the crack epidemic to the opioid epidemic, and that's where the money is for that. If we're going to talk about substance use, let's not try to bash the queer folks for getting money from a disease that was killing them, getting help from a disease that was killing them, that the government did not pay attention to and society walked past and blamed us for having, compared to a substance use disorder that is killing folks, but is also getting a lot of sympathy and empathy because of who is affecting.
I think
Well,
there's
and
some interesting
sorry, go ahead,
things
Tom.
too. I think there's some interesting things too, because what actually brought me into the movement, the recovery advocacy movement, was reading Ryan's first book, where he concluded it with saying, ultimately, we're going to change things with substance use disorders. That's his second book. The first one was American Fix.
That's what I just put up.
Oh, I'm sorry. I thought you put up. There we go. Sorry, my bad. You're this big on my phone, so.
There's
And the book was even smaller. But what he talked about at the end was saying, look, one of the biggest things that changed the country's response to HIV/AIDS, and I was alive then, and one of the people out there, was ACT UP. And that it was in the streets, in your face. And yes, it was mostly white, relatively young gay men, whose families had pretty much disowned an awful lot of us. But it was that in your face, in the streets, shouting that he said we need to do for recovery. And I think that's where there's some similarities. I don't want to compare, the funding. I don't want to compare the intensity of who it's touching and how many people are dying and all of that, because then we get lost in the I think in the details of it. But I thought that was a really valid point he made of, you know, the being in the streets, being loud about it, and so on, was what significantly started to move people in the mid to late 80s, when, as you said, the government didn't give a shit. And actually, even more than that, they actively ignored it. So that's just a thought related to that.
Well, and then I can go down a rabbit hole on this one.
Yeah,
let's not do that. Let's save that for another topic, because I really all right. So anyway, getting back from Vegas. I don't know about you both. I'm still a little off, sleep-wise. You know, I'm very, very confused why I'm not walking around with Heather under a canopy of lights. Heather Ogden from New Jersey. I keep seeing Waldo in my peripheral. that had to be the funniest part of the whole show. And I keep expecting, to turn a corner and to see another secretary of this or congressperson of that. It's somewhat disappointing when I just turn around and look in the mirror and it's just Nathan. How do I get over that? How do I get over that? How are you all coping with being back in the real world? We all have hands-on lives with participants all the time, and it's actually my favorite part of my job, right? How are we taking what we learned there to provide the direct services that we provide?
I guess I'll jump in. I hate salads. It makes me feel awkward. So for me, my sleep is still off a little bit, right? Timing is still off. I had a meeting at 9:00 this morning, and I was just like, it was like the worst thing in the world to me, because it still felt like I was on that time. It was like 6 a.m. I'm just like, this is violence that you're asking me to show up at 9:00 this morning. Like, this is active violence. So yeah, my body's still a little bit off, and it's going to take, I think, some time to readjust a little bit, and that's fine. Because when I came back, I didn't go back to my normal routine. I kind of stayed on that routine of timing, which I do not recommend for anyone. Go right back to your normal routine. But how has it influenced me to come back and do the work that I'm doing? It has influenced me to continue to show up authentically, to continue to show up as who I am and continue to speak my truth, right? That even though the space is what it is, great speakers, a lot of good breakout groups, but I still felt like it was missing a lot of voices or opinions at the table, right? In some aspects, and a lot of conversations. That's just my personal opinion, and that's just me, because I'm just like, every conversation, I'm just like, why aren't there voices from this here? Why aren't queer voices here? Why aren't we have trans voices here? Why don't we have these people in every conversation? So for me, it just fueled me to continue to be loud and proud and continue to talk my crap and show up. I'm trying not to cuss. I'm doing a good job.
You can say shit. Shit.
Okay, cool. But
the F word, or for whatever reason, I don't know why Justin said no to the B word. But okay.
Okay. But I'm showing up, Justin. I'm doing good. I'm trying not to cuss.
I appreciate that. Thank you.
But yeah, it just told me that I have to continue to be loud and proud and be in people's faces, because no matter how much we truly try to be inclusive, that we always miss the mark somewhere. Even I do. Everyone does. So those voices from marginalized communities have to always still be loud and be in people's faces, regardless, to get their voices heard all the time.
Yeah.
It's interesting. I had a brief email correspondence with Rosie, who was the person behind the Nathan, remind me,
Oh,
public advocacy,
the
public advocacy
yeah,
piece.
narrative training.
And yeah, and we were both using the word decompression, that our decompression is up and down and up and down. I slept really great last night. The night before, no way. And I've been reliving it, I think, more than maybe some of us have. I've been showing the concert over and over to, so far 5 out of 8 units at the hospital, and explaining what it was all about, and I've shown Shauntelle a few times, and so on. So I'm kind of reliving it in a way that I choke up every time I do it. So it's still very fresh and very emotional for me. The words that were said, who said them, and then some of the silly pictures we took, and all of that. I mean, we had fun too. I think that we had some really fun moments, and in terms of what we did, what's left to be done, and so on. Let's at least hang on to that a little bit too. A bunch of us lying on a chaise lounge in Elvis's bedroom is a moment I'm not going to forget anytime soon.
I was in the bathroom at one point, and I was thinking, I haven't had this many people in a bathroom since I was in active addiction. And it was very confusing because A, there was carpeting on the floor, and B, I was sober the other day.
Wait, did you say there was carpeting on the floor in the bathroom?
In Elvis's bathroom. Yeah.
Okay.
Gross.
All right. Yeah, that's not. No.
I suppose what happens in Vegas is supposed to stay in Vegas, but no.
Yeah, but not carpet in bathrooms.
No.
That doesn't. That's not supposed to stay anywhere.
Oof.
Your feet get cold though. Maybe you didn't like having cold feet.
Slippers.
Slippers. Yeah, that's a good solution-oriented, Justin. I appreciate that.
Exactly.
It's for me coming back. I as everyone knows, Virginia. It's an election year in Virginia every year, and this year the entire House of Delegates, all 100 members, are up for election or re-election, and of course it's a gubernatorial election year as well. So the governor, the attorney general, and the lieutenant governor. And as you all know, the governor can't serve consecutive terms, but this is, Governor McAuliffe is running for, I guess, technically it's re-election, but not for a consecutive term, against, Glenn Youngkin. I don't know much about Glenn Youngkin. So I won't even presume to speak about it because I don't want to. Recovery's purple, and the McShin Foundation endorses no actual candidates. Democrat, Republican, Independent, Green, Purple, anything. We invite everybody to come and see what happens at the McShin Foundation, but we invite anyone to come and see what recovery is, what successful recovery looks like. But coming back from this, right, it's given me a new lens for a lot of the groups that I participate in. I was in a couple of different sessions yesterday. And the first one was a legislative committee I'm on. The what is the group called? It's the Central Virginia Overdose Work Group or whatever. It's another group, and good people, great intentions. I'm not shitting on the group. And then the smaller legislative committee that I'm on, talking about some things that I hadn't thought of, that I was actually really grateful to hear some new ideas, like offering Vivitrol. Ensuring that people get insurance before they get out of jail, which is something, I've been talking about forever, but offering people Vivitrol shots before leaving jail, prison, to get go back, into back out into the world, which I thought was a really great idea. But one of the big giant things that I've heard twice now in that committee, the committee's met twice, was this real push for mandating drug courts. Now, I was deft enough to steer the conversation to say, can we start calling them recovery courts? And, Tom and I, if you recall, Tom, we had a conversation about this at Recovery Fest, where Skylar was like, that's an easy lift to change the title, right? That's right. But changing a name is one thing. It's like, what happens behind that name? And so, I don't have lived experience in a drug court, but I know people who do. right here in this organization where I am who have had success and have had failure. And so before we go and mandate something like this, and if this is a push from a committee that actually might get shit done, because this is one of those groups that has the ear of the administration, then it's like, well, hold on a second. We need to have a voice at this and say, we need to make sure that we're using evidence-based practices, that whatever's mandated is being overseen by peers in recovery, who can give, hey, wait a second, that's not going to work, that kind of notion. And then we need to get away from this idea that a dirty urine screen is a failure. It's a symptom of the disease of addiction. It's a symptom of the disease of substance use disorder, and it's not criminal. So I struggle, and what I mean by coming back from Mobilize, being in that meeting and being able to actually articulate that and feeling not only like I had voice to say that, but like I needed to say that and say, hold on a second, we're pushing for something that we don't know actually works. And if we look at the numbers, are we doing something that's going to be successful and actually help people? And then, there's different ideas. And then I was on the same thing you were with, Tom. We were at the Barrier Crimes Joint Subcommittee yesterday, and I was exhausted listening to them talk about waivers and how that process would work. And it's nothing I thought of before. I didn't even think about how that would work. And listening to them talk about it kind of made me slightly disheartened. I didn't really know how to say anything. By the time they asked me to speak, I was like, yeah, I'm going to just echo what Melissa said, and that was it for me, because I was so disheartened by the process that it's like, well, hold on. Are we piling too much into one bill that we're not going to accomplish anything, and continue to hurt people and continue to not allow the people who need to do, the people that can do the work, the most effective advocates for recovery, people with lived experience, to be able to get the work done. So it gave me a new charge for that. And then I was in, I don't know, Tom, were you here? No, it was Michael McDermott. I was in the work group for the frickin' Danny's Law. I didn't know I could be as pissed off as I was. It's like the bill. For those of you who are listening and thinking, what the hell is Danny's Law? So Danny's Law was a bill that was initially put in through a Republican senator in 2019. No, in 2020. Excuse me. It was Senator Vogel, and she put in this great bill that would have mandated peers in emergency departments, the lock zone, training, all these avenues to recovery, all of these services and access to recovery support services. Right there off the jump in the emergency department, right when you have somebody right there, that moment of desperation. That bill got watered down completely. It created a committee to look at what best practices could be, that the hospitals may, include. So basically a bunch of bullshit, a work group to say, oh, this is what you should do, but, do whatever the fuck you want. I said it. Tap me out. I'm sorry.
You did. You did say it.
Damn it.
Quarter in the swear jar.
Oof. I'm pissed off about this. I'm really pissed off about this, because the same stupid group of people getting together to talk about nothing, not actually helping the problem, not actually solving anything, sitting around saying, we can't give the people Narcan because that's not what emergency departments do. I'm like, I can walk right around the corner here in my building where I work and say, hey, I need some Narcan to take home, and they'll just hand it to me. No questions asked. And you know what? I can legally use that Narcan on somebody, right? But you can't give that to me in a hospital setting? What the F, man? Are you serious? So it boggles my mind. Well, we can't have peer recovery specialists in the emergency department because who's going to pay for that? Come on, man. We're just putting recommendations together. We're not saying we're not going to have all the problems solved. So that just pissed me off. And I could see Julie Funkhauser, who is the one of the champions of the bill. Her husband Danny is the name, the bill that is named after Danny. Julie was initially, we thought, on the committee and then not on the committee, and then she's sitting in the corner in the room, all frustrated because I was there in the meeting, and it's disheartening. I missed the public comment section, and they were probably smart by putting the public comment section at the beginning before they actually had the work group meeting, because man, was I pissed off by the end of that meeting, and I really wish I could have spoken. And that's why I'm sharing about it now. It's like we need to make sure that we don't look at that and say, well, it's done, because it ain't done. They didn't do jack shit with that bill. So we need to make sure that we're looking at what are the best practices for hospitals and emergency departments. I'm rambling. So tonight, right, the four of us, the three of us, and Aaron, we're meeting again. And anybody who shows up, I haven't really pushed this out to everybody, and I'll tell you why. I figure we can collect ourselves and say, how are we going to onboard people? And then for the next meeting, when we maybe have collectively a little hive mind, maybe we can start, reaching back out. But I think, tonight when we all meet, what are we bringing here? Because I've got some new things I'm charged up about. And it all goes back to access to recovery for me. So what are you charged about now that I've rambled on for 10 minutes?
I'm kind of back to, especially being back at work. And one of the things, and Heather and I talked about this in the hot tub in particular, but sitting next to each other at the concert too. I know. I had to throw it. Is there was very little attention paid to people with co-occurring mental health stuff. Almost none. And that's my particular passion as a person with co-occurring mental health challenges, which in my case, in some ways preceded and in some cases followed my journey in recovery. And there was really, almost no mention of it. And so she and I want to do something to raise the visibility of that next year. And being back working with people who significantly are challenged by both things. I thought it was really interesting talking to Lauren, who was the state representative from Michigan, from Washington State, who got the detention law in Washington State covering substance use based on her experience with her best friend. And I walked up to her after and said, well, the mental health people typically would be up in arms about any type of additional detention of people against their will. And I said, so what happened? She said, oh, the mental health people thought it was substance use. They didn't care. And, and my jaw dropped. There's just this huge gap between the two. And I think my awakening from that was, that's going to be my focus. That was what I was charged up about. Noticing that there's that huge gap there. And almost all of us have some mental health struggles. Almost all of us, I think in one way or another, started our journey into addiction, self-medicating something. And whether that was stuff that was done to us or stuff that was, organically developed between our years, we're still researching, but I really hope that we're going to pay some more attention to that in the coming year.
Yeah. Thoughts?
Yeah, for me, it always goes back to the same thing. What are we doing to make change for people to access recovery supports? What are we doing to make recovery support easy to access? What are we doing to make sure that once people access those things, that it's safe for them to be in those spots, and the folks who are working with them know how to support them. So it always goes back to, for me, is education, advocating, and for people to be more inclusive of marginalized folks. And when we think about marginalized, it's a lot bigger than just Black or brown or queer or not. It's folks who have kids, single parents, all these different things, co-occurring disorders and mental health diagnosis and things like that. How are we making these spaces inclusive for them and safe for them? And what I want to bring into the space and into our meeting today and stuff is like, what are we doing? Like boots on the ground. Because me, I'm a boots on the ground type of person. I want to be out there. I want to do stuff. I want to be action, not just like let's talk about and we know, and I share this openly. I'm not into the government stuff. I'm not into the bills and all that stuff. To that means nothing to me because I feel like that they should not have a hand in our support and recovery because they don't know what we need. They don't have our best interests at heart. Most of the time, it's like whatever's going to make them look good, and that's just my opinion, right? And I'm allowed to have that. I feel like we should be determining that we should be providing those supports. If they're not giving what we need, if people are not getting what they need to be successful, then we need to be boots on the ground out there, giving them what they need to be successful or to stay alive. Like, so for me, it's bringing in that space is like, what are we doing boots on the ground? And not just talking about policies and procedures and signing petitions. It's like, what are we doing out here to change the life for the folks who are on the streets that those bills are not going to even affect or help or change their lives. And I always go back to that because that's just my passion where I'm at.
Yeah, and I love your passion for boots on the ground work. There's an intersection, where all three of us are coming at with slightly different. No, there's an intersection where all three of us are coming together at exactly the same point, and that's increasing access to recovery. And that's and I think that anybody who's part of the Recovery Advocacy Project, and thank you, Justin. I know you're putting the Facebook link down in the comments to our project, but whatever we're doing, we've had so many amazing conversations and so many exhausting conversations. That one particular conversation I had at Mobilize. Well, I won't repeat oh my goodness, though. I'll tell you what, I'm still pissed off about that. I still have a resentment there. And that's me. I got to get over it, right? I got to get over that because obviously something is missing right there. And I had a really good conversation, not with that person, but with somebody else who actually broke it down a little bit about why possibly that person had that feeling, but also why that person had a similar thought pattern. However, it was articulated in a much, in a less derogatory way. And I appreciated that because it gave me perspective. I'm constantly reminded and amazed that I don't know everything, and I'm grateful that not only am I open to realizing I don't know everything, but like we have this really amazing group of people around us who can help fill in those gaps. For me and for you and for you and for everybody else. So I think that's one of the biggest takeaways from Mobilize for me is that I don't feel alone. I mean, I didn't really feel as alone back, before Mobilize. I have a community, for my recovery and also for our advocacy. But my community got bigger, with Mobilize, in all its messiness and all its sort of just wonderful ooey gooey ways. Like even that particular person in that conversation, even as much as I have a little bit of resentment there, I recognize that person's coming from a place of love and trying to do more too. I don't particularly like how that person's doing it, but I like that person's sharing with me and making me think about what we need to do more instead of me getting too defensive. I'm getting a little defensive, but too defensive. It's like, all right, well, can we do more? And how can we be more open? And what do I need to change in myself? And the organization I work for as well. So that was a pretty eye-opening experience, that itself. We have an opportunity to really help shape, policy. Shauntelle, I respect the fact that you're not. I totally get what you're saying, right? Like, get the heck out of it. Go away. We need to kick them out. Like, it's not like if I feel like if we don't like jump in, as we do, I think we have a pretty good balance of this. Like, if we don't jump in, and say, well, wait a second, that's not working. Just stop doing that. Stop doing that. Which is why, we talk about recovery services. and access, one of my biggest personal issues is reclassification from a felony to a misdemeanor. In fact, I'd love to do a Portugal model too. I mean, that, I know that would reduce stigma. That would get people out of the criminal injustice system. I like that phrase. And it would get people, hopefully, remove a lot of barriers, and increase, access to recovery by giving people a chance instead of saying, well, no, you're in trouble, So I feel like there's so many different ways that we can all approach that, and I'm glad we all have slightly different interests in achieving essentially the same goal, and I love that.
I had two couple of things. The first is that the same way there are multiple pathways for our individual recovery, there's also multiple pathways for how we want to change the system. We all want to kick it in the ass. The question is, where do we kick it, and so on. Some of the governmental stuff, we talk about same-day access. My dream would be to see that everybody who walks into a community services board, which is where most people go, or an awful lot of people go, they see a peer provider that day. And nobody's talked about that yet. We talk about same-day access, but we don't talk about, well, what do you access on that same day? Well, hopefully you would at least see a peer specialist on that same day. And we haven't really, and that's sort of something I thought about while we were there, kind of putting those two things together. And you were talking about putting people on naltrexone, leaving the prison system. A friend of mine and I are working on a grant proposal to do the same thing for people leaving the state hospitals. Whether it's a 30-day injectable of that or a 30-day injectable of Suboxone, because they're not going to be seen in 3 days. They're not going to necessarily be seen in a week by whoever it is they're going to. And how do we tide them over longer and give them, no pun intended, a better shot at recovery?
No pun intended. It's all of the things that I've heard, that I agree with over the last several weeks, and most everything I agree with it. Even though it seems like a tall order, nothing seems impossible. Nothing really seems impossible anymore to me. Maybe I got this little bright-eyed optimist thing going on too, but I also like to raise my voice. There were two moments, and I had two moments. One with Shauntelle, one with Tom, during this whole thing that I want to point out, because we talk about policy. And Shauntelle, I hope you don't mind me telling this little story here, but we were talking about trans inclusivity in SAMHSA's reporting of substance use disorder, the effects on individuals, and not reporting, out on what the effects are on trans people. And of course, why that's important, because we know that trans people are, disproportionately affected by substance use disorder, just as gay, lesbian, bisexuals, which are measured, are disproportionately affected by substance use disorder. So, and we were talking about that, and in the room was, what was her name? What's her name? Denise, not Denise. The woman from SAMHSA. Yeah. Well, anyway, a director of SAMHSA, and we're sitting there, and Shauntelle was like, "This is really getting in my thing, and I want to say something to you." And you kind of said, "You think it's appropriate?" We're sitting at I want to say cocktail hour, but it wasn't cocktail hour. We're sitting at the hors d'oeuvres and stuff, and I'm like, "No. This is where my privilege comes in. Come on, let's go." And I just grabbed you and said, "We're gonna go talk," And it's like, I don't fear those conversations. I've never really have feared those conversations. I'm always, gonna jump in and be like, "Hey, what's going on? I don't give a crap if you're eating lunch or something. I'm gonna talk to you. This isn't right. Let's have that conversation. Why aren't you having this conversation?" And I'm like, I've maybe I haven't always been that guy, but I'm certainly that guy now. And I love that. I love that. And it's like, it's wrong, what they're doing. And she wants to make it better. Let's see if they do make it better, and we'll go from there. And I think we had the same conversation with Tom Coder as well. And then with Tom, Tom Jackson, here, Tom and I, we went up to Labor Secretary Walsh and we asked about barrier crimes. And what did he do? What did he say? Do you remember, Tom?
Well, that's where we were talking about getting to McAuliffe, right? I think where one of the speakers was the Clinton Foundation's director of substance use and recovery. And so, Secretary Walsh said, well, talk to him, get him to talk to Clinton, get Clinton to talk to McAuliffe. So that's where I was talking about those 2 degrees of separation where, and Clinton moderated that closing panel discussion. That's where I talked about sort of that 2 degrees of separation in terms of getting to somebody who's running for office and raising our visibility. We talked about you talked about reclassification of stuff and so on. I went and read McAuliffe's thing on expungement and barrier crimes. Well, there's nothing about barrier crimes. It's all about expungement, but there's nothing in there. Who's going to help somebody get their record expunged? It's not a simple thing to do. I worked for 15 years with clients trying to get their voting rights restored, and it got easier over time, but it still wasn't something that the average person could do on their own. Who's going to help them do it?
And that's also determined by who's sitting in the governor's house, because the governor ultimately has a say on that.
Yeah.
Yeah. On voting rights. So yeah, no, that's a good point. But, to the point though, that, we talked to the labor secretary about barrier crimes, and the secretary was the one who made the connection for us because of course, Terry McAuliffe was Hillary's finance director, I think, something like that. But I mean, he's been friends with the Clintons forever. And of course, which is, that's why, being fearless and being able to say, hey, how do we do this, is the way to go. Because I do, again, optimist pie in the sky, I do believe that most people in public service are there to help. I think they want to do the best, and certainly got that impression, especially when you're in the first couple of months of it anyway, like Secretary Walsh, but he's one of us. He's one of us. He has lived experience. He's been there, in the trenches. And he tells a very compelling story that's very relatable. Even as that story that's relatable is him crashing into the Capitol building, as a representative from Congress. So wait, no, that was Patrick Kennedy.
That was Patrick Kennedy.
That was Patrick Kennedy. Walsh was Mayor of Boston. But anyway, yeah, but both relatable stories, and yet so unrelatable in some other ways, We're wow. It's we're at the 52-minute mark, 52.5-minute mark, and I do want to land this plane gracefully. We're going to see each other in a few hours, and we're going to talk about some of the issues, and we're probably going to have some of the similar conversation we've had now. Any thoughts to close this out? Shauntelle, you want to jump in? And Tom, you want to jump in first? It doesn't matter to me.
Go ahead, Shauntelle.
Yeah, my thoughts to close this out. I want to go back to that conversation about, trans and non-binary folks being excluded from SAMHSA's study around substance use in the LGBTQ community, why it's important, and why other recovery individuals need to actually advocate for this, because we're not getting accurate data if we're excluding people, but also we're not getting accurate funding. No recovery organization is getting accurate funding to support or help folks if we're excluding people and not getting the accurate data. So that affects every single individual who is working in this field or advocating for this field, that we're missing data for a group of folks, a whole community of folks who are disproportionately affected by substance use disorder that a lot of us support and help in our study. So it is very, very important to take action on this, to speak about it, and ask the folks in SAMHSA, those that because a lot of us know folks who work for SAMHSA who are part of this recovery community, what are they doing about it, when they're going to make the change, and tell them that it needs to be changed so we can actively offer support for every single individual who is experiencing a substance misuse disorder.
So my takeaway, I think, is, what actions, how do we narrow down the actions we can take? How do we make them specific? That whole SMART thing, specific, measurable, all that kind of stuff. I can never remember what all 5 letters stand for. And I teach it. So I have to look at my cheat sheet. But that, again, we really, we really work on stuff that we can get done. And that, there's that old, trite saying of success breeds success. And so, so what can we accomplish in the next 6 months? What manageable number of things can we really focus on? And I put some things together. I mean, the whole idea of same day peer access. No, but I don't think anybody's mentioned that I can think of. Although actually it's stolen from the police chief of Gloucester, Massachusetts, who started one of the original throw out prosecuting people and send them to recovery.
Well, to be fair, Tom, McShin, every chance we get, we bang the drum about same-day access, not same-day assessment. I can't tell you how many times, but that we're one little voice,
Right, but has anybody said same-day peer access at the CSBs? And I don't, and so that was, sort of two disconnected things that I kind of put together. And if we work on increasing the peer Medicaid reimbursement rates, that makes it possible. So those things are kind of connected. I think I connected a lot of dots. That was my takeaway. I think I connected a lot of dots.
Yeah, Tom, I really love that. That's your takeaway. I think you've just articulated my takeaway. Is I've connected more dots, maybe created a few more dots, but I've certainly connected more dots, and I have a lot more hope, but I also, like both of you have stated, I feel like there's so much more to do than I realized there was to do, just a few weeks ago. I'm excited to meet with you all tonight to talk about onboarding new people, to talk about the issues that we're focusing on, the issues we're going to focus on. How do we get the Virginia Recovery Advocacy Project name out there some more, and in the mouths perhaps of the legislators and people on the ground? Justin, before we leave, you got any last thoughts?
Well, I'm actually going to shift gears for a second. I just want to thank everybody, all of our normal watchers, for being patient with us. I was actually supposed to host a show yesterday. I've been kind of sick recently, and I had no voice, so I would not have been able to host. And as a matter of fact, I'm not even in my office right now. As you can see, I'm in my bedroom. But we're still able to get it done. So thanks everybody for being patient. I know nothing new was uploaded yesterday, but we got you today. So thanks again, and that's it.
That reminds me of an old boss I had years and years and years ago. I tell this story a lot, so forgive me. I think all three of you have heard this, but this old boss, a job I had years ago, I was an events manager for a botanical garden in Florida. And the people I worked for, this select committee of very, very wealthy, mostly women, very, very wealthy, who approached everything with a sense of urgency that I would love to see put towards substance use disorder. How about that? But everything had that sense of urgency, and it could be very scary and daunting to somebody, And my boss at the time said, flexibility and a sense of humor, and you'll get through it all. And I take that with me everywhere. But I also remember she hid a bottle of gin in the bushes, so not everything about that was good.
There it is.
Shauntelle Hammonds with Peter's Place, and Shauntelle, we didn't talk about the other thing. We're going to talk about the other thing later, another time. We'll talk about it tonight. Tom Jackson, a trainer of trainees of the peer recovery specialists. By the way, I'm taking an overview class on Saturday so that I can go take my test, because I took the PRS training like 2.5 years ago, something like that, and I never took the test.
Good. Get certified.
Right? I mean, I know I'm already.
We
I'm
need the
already
visibility. We need the visibility. Well, we know that.
So I'm taking that so I can get an overview. And I do, Tom, we need to connect because the version of the book that I have, you mentioned a page number and it didn't jive with what I have. So I just want to connect. Maybe there's a different, but anyway.
Yeah, I have the more recent one.
Okay. And on that note, thank you all for being guests again today. Wonderful, wonderful guests. Thank you, Justin. We will see you all next week.
Thanks,
Bye.
Justin. Bye.
Here at McShin, we believe in the McShin way, which is authentic recovery support service providers, people with lived experience, bringing that experience to those who need that lived experience in recovery.
Here at McShin, we believe in many things to support our mission. We believe in women empowerment.
What I love most about what we believe here at McShin is we believe in the authenticity of the peer-to-peer approach.
Here at the McShin Foundation, we believe in giving people opportunity.
Here at McShin, we believe in the inherent worth and dignity of every person.
At the McShin Foundation, we believe in helping people reach their full potential.
Here at the McShin Foundation, we believe in multiple pathways to recovery.
Here at McShin, we believe in placing principles before personalities to help spread hope.
Here at McShin, we believe that recovery is possible and that any person seeking recovery can become a more acceptable, responsible, and productive member of society.
Here at the McShin Foundation, we believe in self-discovery.
Here at McShin, we believe in saving lives and offering second chances.
Here at McShin, we believe you can do this.
Here at McShin Foundation, we believe that we can only keep what we have by giving away, which is why we continue to help others like us seek and find recovery.